So my problem statement was CLABSIs are a preventable infection that we as nurses can help to stop. There's a high rate of infection, mortality, and hospital costs, of course, that go with that. So there needs to be a change in the use of disinfection caps can help decrease these infection rates. Purpose statement, as nurses we can strive to ensure our patients receive excellent care and do everything we can to prevent central line infections. Outcome, 5 Center will have a disinfection cap use rate of 100%, and which would result in a 0% CLABSI infection. I think that at one point we did have one CLABSI from a dialysis catheter, right? Okay. So that can be prevented because we can put those caps on there. I believe it was 1 in every 10 hemodialysis catheters fail because of CLABSIs. So they also have the new trialysis catheters for the dialysis patients. Catheters, we actually, as nurses, can use the purple port for that. I talked to the dialysis nurses as well as the IV team, and we can use that to draw labs. That's what it's there for. So we need to make sure, especially with any of the dialysis catheters, that we have those little green caps on those as well. Around the world, CLABSIs are lengthening hospital stays and increasing patient mortality rates, as well as hospital costs. Out of 80,000 people in 1 year with CLABSIs, 20,000 of those people died. The cost for one patient with a CLABSI is estimated at $45,000, which is really expensive. That's like another nurse, or like more supplies that we could have, or more nursing assistants. There's a lot of things that we could do with that money. The total expenditure for the United States is approximately $2.3 billion just from having CLABSI infections. They are also responsible for more than 200 to 400,000 hospital-acquired infections, which we as nurses can prevent. They are one of the main hospital-acquired infections. And the little caps, they're super easy to use. Like I said, we already do a really good job with it. But they contain 70% isopropyl alcohol. They provide a physical and chemical barrier. And here at AMED, we also scrub the hub too, to ensure that there are no more germs. We need to use them on PICC lines, any implanted ports that are being accessed, internal or even external jugulars, just because they are technically anything over the chest. I think here at AMED is considered like a central line. So even if they have like a normal IV site on the chest, I would use one of those caps. There was one hospital, I don't remember exactly where they were at, but their ICU unit did a project with these because they had a really high CLABSI infection rate. They started using the caps, and out of one whole year, they had one person that had a CLABSI, and it was because that patient coded and would prevent CLABSI. Hand hygiene, scrub the hub every single time. You're supposed to scrub it in between, even taking, like if you were gonna flush it, you flush it, scrub it, do Lasix, scrub it. Use the sterile technique during insertion and during dressing changes. Make sure you have a mask on yourself and the patient during any central line dressing change. Use them on all hub sites for central lines, including the ports and hubs on the IV tubing. If they have any continuous IV fluids going, put them on the little ports where you attach your syringes to. Make sure there are maximal sterile barrier precautions being used. Use chlorhexidine to cleanse the skin. And the patients need to be bathed daily if they have a central line with the chlorhexidine-based solution. And obtain an order to discontinue the central line as soon as you see that they don't need it anymore. The quicker you get it out, the better they'll be. I had thought of like a sign we could use to go on the outside of a patient's room that has a central line, and we could also add it to our acuity sheet. That way the charge nurse knows, and we can make sure that those caps are being used. And we can have the sign on the outside of the patient's door. That way the nurse and assistants know that they need to use those cloths as well. What questions you got?
Sounds good.
Thank you. Thank you.